Planning for improved health service delivery for First Nations, Inuit, and Métis people is continuously evolving. The Indigenous Health Program continues to focus on customized healthcare approaches and improving access to health services, emergency and disaster response, traditional wellness and cultural supports, patient navigation and care. An example of this is our Indigenous Cancer Patient Navigator, who is a registered nurse with specialized training in cancer care located at the Cross Cancer Institute. They help cancer patients feel safe and comfortable in a clinical setting to better understand the care system, answer questions, or educate about tests, treatment, symptoms, and medications. Cultural helpers provide spiritual and emotional support, information and education on Indigenous culture and beliefs to healthcare providers, patients, families, and staff at the Royal Alexandra Hospital, University of Alberta Hospital, and other Edmonton sites on a referral basis.
Our role is to bring that culture and the traditional way of life, traditional ceremonies to our people. We have different ceremonies to go throughout the year. We are starting to prepare now for our spring ceremonies where we get to set up our teepees at different locations. It is when we set up our teepees, we smoke our pipe, and we have our traditional feast. In the fall, then we will take our teepees down. And when we do our medicine picking, we go out for 2 days and then we pick medicines to bring to our people here at the hospital.
The hospital can be very scary, especially for our people who historically don't have a good relationship with institutions. So part of our role is a part of that history and building that relationship with Alberta Health Services and the Indigenous population.
We really are truly blessed by the direction and the vision of the elders. The Sweat Lodge was brought to us, of course, by one of our elders, and is located at the Alberta Hospital, Edmonton. It is an opportunity for staff to come and learn, to come and be with us and pray with us. It's also inviting to our community members, and there is a specific time for our patients of Alberta Hospital.
The Edmonton Zone has been offering a traditional sweat lodge at Alberta Hospital Edmonton for many years. The grounds at the hospital are very conducive to having such a ceremony in a natural environment. Edmonton's Indigenous Wellness Clinic provides a culturally appropriate and safe environment for patients to receive care and work towards their best possible health in collaboration with a multidisciplinary team that includes physicians, nurses, dietitian, physiotherapist, Indigenous health coordinator who advocates and supports Indigenous patients and families from healthcare to community services and is active in mental health first aid instruction, mental health and addictions cultural helper who provides long-term support to Indigenous clients with mental health and addictions issues, including individual supportive counseling. Services offered in the clinic include family medicine, chronic disease management, chronic pain, women's health, palliative care, and diabetic retinal photography screening. The clinic holds a monthly 4-day, culturally based, holistic diabetes education program with 1-day follow-up appointment and has been utilized by Indigenous people from the Edmonton Zone, northern communities in Alberta, Northwest Territories, and British Columbia. Appointments, referrals, and diabetes education program availability are made by calling the Indigenous Wellness Clinic at 780-735-4512 or toll free at 1-844-441-4512.